I'm going to start with a few things here, and one is a little bit outside of the usual topic, but the first one has to do with the usual kind of things I talk about, which is the subject of testing, and specifically, I mean testing for COVID. Because what I'm finding is I've been talking about this for 18 months or so, and then you hear that people that you've talked to, read the books, read Breaking the Spell, know everything there is to know about this, and then you hear that so-and-so got a test, and I sort of scratch my head and think, well, how did that happen? And you hear it from Aaron Rodgers, the football player, has been tested every week or every day or every 2 days or something. And then there's more and more information about the vaccines are not effective based on tests, and this is happening. And we know that if you don't get a vaccine, so-called vaccine, then you have to get tested, and testing. So I thought it might help to go over once again exactly what is the problem with these tests, so that we clear this up once and for all, because you need to know what is actually being tested for before you get a test, and why just the process of getting a test will make healing from whatever is ailing you more difficult. It is not a benign thing to get a COVID test. It is a destructive, corrosive step in your whole ability to heal. So why is that? So let's talk about tests first. There's basically three kinds of COVID tests. There's the PCR test, there's the test for so-called COVID antigens. An antigen, it refers to a protein that stimulates an antibody response, and a COVID antigen test refers to the fact that they're taking a protein from the alleged COVID virus, in other words, SARS-CoV-2, and testing for the presence of that protein. That's what an antigen test is. And then the third test is an antibody test, which tests for a different kind of protein, which is allegedly made in response to the exposure to an antigen of the virus, in other words, a piece of the virus or the whole virus. So you make antibodies against a certain protein, i.e. the spike protein or some other protein of the virus, the antigenic part of the virus. You make an antibody against it, and that means you had the infection. Now, in order for any one of these three tests to be a valid test, it has to meet all three of the following criteria. Number one, the piece. So every one of them is talking about, they're not testing for a virus. We should be very clear about that. They're testing for a piece. In a PCR, they're testing for a piece of genetic material. In an antigen test, they're testing for a protein piece of the virus. And an antibody is an antibody that you make, a protein against a piece of the virus. So criteria number one for this to be a valid test is we've had to have proven that that piece, whether it's a piece of genetic material, it's a piece of a protein, or an antibody directed against the protein, came from that virus. Obviously, because if the piece did not come from the virus, then there's no way it could be a test for that virus. The second criteria that needs to be met is we have to have proven, somebody has to have proven that that piece of genetic material or protein or antibody against a protein is against a piece of the virus that is unique to that virus. And if it isn't unique to that virus, then there's no way of saying it's a test for that virus. And the third criteria is we need to know the error rate of the test. In other words, the false positive and false negative rate of the test. If you don't know the error rate, it's not a valid test, because there's no way then to know whether it's true or not. So let's go through these in order. Number one, you have to have proven that that piece came from SARS-CoV-2. Now, everybody who's been following me and is listening to this, I hope will know that SARS-CoV-2 has never been found, never been isolated, never been purified. There is simply no way to know that that piece came from that virus, period. Therefore, since it doesn't meet the three criteria, it is an invalid test, period. Number two, you have to show that that piece of genetic material or that piece of the protein is unique to that virus. So again, for the same reason, nobody has ever isolated, purified, or characterized an actual SARS-CoV-2. Therefore, there's no way to know that that piece came from that virus. And in fact, with this one, as I've been over many times, we know that, for instance, the genetic sequence that they're testing for has been found in at least 93 different parts of the human genome and over 90 different microbes, fungus and bacteria. Therefore, we know without any doubt that they're not testing for anything unique to SARS-CoV-2, which doesn't exist. So even if it did exist, it's still not unique to that virus. Therefore, the test is invalid. Number three, in order to know what the error rate is, what we have to understand how a doctor or a scientist calculates the error rate. And when I say error rate, I mean both the false positives and the false negatives. So the easiest way to explain this is to use an analogy, which I've done before, which is of a pregnancy test. So if you take 100 women who you know for 100% sure they are pregnant. Now, if you're going to do real science, you of course have to ask yourself, how do you know the woman is pregnant? So you have to answer that question. One way is you can feel a baby in there. And if you put your hand long enough there, you might feel movement or kicking or all kinds of activity in there, which would make you think that there's actually a live fetus inside that mother's uterus. If that isn't good enough, you can actually do an ultrasound, which I would not recommend in a normal situation. They are very toxic interventions and almost never needed. But if you wanted to be double check, you could do an ultrasound and you could in fact see the outline of a fetus inside the uterus. Now, you might actually even ask the question, do ultrasounds produce artifacts? But I think you could probably convince yourself that if you see this image with the head and fingers and toes and genitals and chest and everything, and in every case, what happens is a baby emerges at some point out of the fetus, out of the mother's uterus, you could be pretty sure that you're dealing with a reliable, non-artifactual test. So you start by knowing 100 women, 100% sure they are pregnant. Then you do a blood test. And you say, I want to test for HCG or some other hormone. You could test for anything you want. If 99 of those tests in a woman you know are pregnant are positive, then you have a 1% false negative rate. And so that's the false negative rate. It allows you then as a doctor, if you are confronted with a woman at a certain time in their pregnancy, and you know that this is a 99% accurate, 1% false negative rate, that allows you to judge if you get a positive test. I'm 99% sure that there is actually a pregnancy. And that helps you make clinical decisions. Now, to calculate a false negative rate, you could take 100 women who you know for sure aren't pregnant. So for instance, you could take 100 postmenopausal women, or you could even do it with 100 men, none of whom are pregnant. How do you know? Because women don't get pregnant. So you know for sure that all these 100 people are falsely negative. They are not pregnant. Sorry, not falsely negative. Then if you do a test and 2 of them are positive, that means you have a 2% false positive rate. And that, again, allows you to help with your clinical judgment. Now, with COVID tests, there is no equivalent of a pregnancy test where you know for 100% sure whether the person has COVID or a virus or not. There is no such test. We know that viral cultures are not accurate. They're fraudulent. And so there is no standard by which you could measure the false positive or negative rate, in which case it's not a valid test because you have no idea what the results of this test mean. In other words, as I've said over and over, there are no false positives, there are no false negatives, there are just falses, because we don't know that the piece we're testing for came from a virus. We don't know that it's unique to that virus. In fact, we know that it's not. And if there is no virus, it can't possibly be unique to it. And we have no idea of how to calculate the false positive or negative rate. Therefore, it's not a test. It is not a test that should be ever used by anybody because it gives you no meaningful results. Now, the question then is, well, what difference does it make? So it goes back to another example, which I've given over and over again. Probably people are tired of hearing me say the same examples, but early on in my medical career, I had a Christian Science patient, and they had an injury to their leg, and I said we needed to do an x-ray, and they said no, they can't do an x-ray because once they see the fracture, if it's fractured, it will make it more difficult for their mind to heal it. And since they were essentially had a health system based on their mind healing their body, which is not a bad idea, they did not want to do that test. And even though at the time it didn't make much sense to me, over the years, I've learned to appreciate that that is not a bad idea. I'm not saying there's no situation that you might want to do some test, but if you have a test that is completely irrelevant, illogical, and anti-scientific and gives you no meaningful results, and you, for whatever reason, except if somebody has a gun at your head saying, if you don't do this test, I'm going to shoot you. But if you volunteer to do that test, you will find yourself sucked into the delusion of COVID. And it will be that much harder for you to heal, because there will always be a part of you thinking, I must have COVID, even though if you were pushed, you would have a very difficult time describing or defining what it is that you mean by COVID. And what then inevitably happens is you make bad decisions, like you get shut off from being part of your football team in certain cases, or you're not allowed to go to a fair or a festival, or you quarantine yourself, or you allow other people to quarantine you, or you take toxic drugs that you wouldn't have taken if you didn't know that you had this irrelevant test. And you start to worry, there must be something really wrong with me that I can't understand. And so that worry and that fear makes, like the Christian Scientist people found out years ago, makes it that much more difficult for you to heal. And fundamentally, you are perpetuating the primary delusion, which is COVID. So that is a plea for people to think, I was going to say, think twice. Twice may not be enough times. Think 25 times before you voluntarily submit to any of the tests. They don't give you any valid information. They confuse your mind. They make you do things which you wouldn't have done otherwise. They don't make you, but they lead you to do things. And fundamentally, this is largely a so-called pandemic of testing. It is not a pandemic of a viral infection. It is a pandemic of testing. And one of the only ways out of this pandemic is to stop testing. And if those of us who know the actual facts about the virus and SARS-CoV-2 and viral infections, if we're not willing to stop testing, then I don't know how this is going to end.